Hi everyone, this is Dr. Kaplan, and I just want to take this time to thank you for following us here at the Kaplan Center. And I also want to encourage everyone to please Instagram and text a question that they have so that we could have a list of questions we could answer every Thursday, so we could have a back and forth communication. Today we're going to be talking about tummy tuck, indications, why people are good candidates for tummy tuck, how the procedure is done, and what results people can expect from that. A tummy tuck is a body contouring procedure. Contrary to what people think, it's not a weight loss procedure. The procedure is not done for people to lose weight. The purpose of the tummy tuck is for people that have extra skin who aren't good candidates for liposuction. What we do is we raise a flap of skin and subcutaneous tissue. We raise that all the way up to the rib cage, and then we tighten the rectus abdominis muscles, which are like their muscle columns. We tighten those up, and then we bring the abdominal wall flap all the way down, and we take out the extra skin and make the abdominal wall very tight. So people that aren't good candidates for liposuction are ones where if we suck out their fat, their skin will just hang. The skin will not retract back. If the skin retracts back, then they're good candidates for liposuction. If the skin will not retract back, and we know this from experience and from examining the skin and the elasticity of the skin, if the skin doesn't have good elasticity and we feel that the skin will hang following liposuction, then that patient is a good candidate for a tummy tuck, as well as if the patient has what's called a rectus diastasis, which is a separation of the rectus muscles after pregnancy or after weight gain. Those muscles separate, and then when you do a sit-up, you'll see a bulge from your abdomen. I think that the question is whether to do liposuction with a tummy tuck. There are a lot of surgeons that do liposuction with tummy tuck. I think that it's okay to do that if you have no concerns over the blood supply of the abdominal wall. If the patient is a smoker or the patient is a diabetic, I would opt to do the liposuction first and then wait several months and then do a tummy tuck. If you do liposuction with the tummy tuck, you just have to not be very aggressive in certain areas of the abdominal wall, because once you raise the abdominal flap during the tummy tuck, it does compromise the blood supply to parts of the abdominal wall. So the question is C-section. What can we do with C-section scars and a tummy tuck? C-section scars can be used within the tummy tuck scar. So you could actually use that C-section scar and just extend it laterally that could be your incision for the tummy tuck scar. So you don't have to make two separate incisions. As a matter of fact, it's contraindicated to make an incision parallel to the C-section incision, because that will compromise the blood flow to the skin island between the two incisions. So we actually use the C-section incision. We actually use the C-section incision for our tummy tuck incision. Unless you're doing a mini tummy tuck, which is basically just raising up the abdominal wall to the level of the umbilicus or the belly button, in that case you don't have to take down the belly button. But if you're doing a full abdominoplasty or tummy tuck, you basically free up the umbilicus or belly button from the abdominal wall. You don't detach the umbilicus, you free it up from the abdominal wall, and then you raise up the abdominal wall. The belly button, you see that coming through the rectus abdominis muscles. Then when you pull the abdominal wall flap down, you create a new hole for that belly button. The recovery for the tummy tuck, it's very important that patients don't drive for several weeks following a tummy tuck. Once patients start twisting and trying to get in and out of cars, what happens is the abdominal flap that we're trying to seal down to the abdominal wall, you start creating spaces in between the abdominal wall and the muscles underneath, and that's when you get fluid collections, which are called seromas. So we really recommend allowing that abdominal wall to seal back down to the musculature underneath so that no fluid collects and you get a good seal of the abdominal wall to the rectus muscles. So we do recommend wearing a compression garment or a abdominal binder. We also either place skin glue underneath the abdominal wall so that these pockets cannot form or collections of fluid such as a seroma, or we place Jackson Pratt drains, which are basically little suction drains to suck out any air and also to further seal the abdominal wall to the underlying rectus muscle. Again, if there's any movement between the abdominal wall and the underlying rectus muscle, there's more of a chance that fluid will collect, and what that requires afterwards would be drainage of that fluid over every week for several weeks until that seroma finally goes away. So we do recommend compression garments or abdominal binder anywhere between 4 to 6 weeks. We don't recommend any exercise for the first several weeks. Usually during the first week you will be walking over in a bent position because the abdominal wall is pulled so tight that you're walking in what's called a reflex position, which means you're bent at the waist. When we do a tummy tuck, the underlying muscles, the abdominal wall, which is comprised of the skin and subcutaneous tissue and the fascia, that is raised up as a flap to the ribs, or the costochondral margin, which is basically where the ribs meet like a V. So the abdominal wall is raised up to that. Once the abdominal wall is raised, what you see is the rectus muscle, which are 2 columns of muscle that come from here down. So that is not raised up. The only thing we do to the rectus muscle is we tighten them together so that the underlying musculature is tight and it holds the inner organs in more tightly so that there's no bulging and you have the appearance of a more tight or pinched in waist. Okay, guys, thank you very much for watching this. And again, thanks for following us, and please take some time and ask us some questions, and we'll be sure to answer them next week. Thanks again.